Hi, my name is Dr. Laura Ross. I'm a pelvic health physical therapist and a specialist in gender affirming care. And today I'm going to show you 4 exercises that you can do after you've finished tucking for the day, whether you use a gaff, a couple of pairs of underwear, or tape. The first exercise I recommend after tucking is to do some breathing to allow more movement and to restore kind of a baseline to your pelvic floor. Your pelvic floor muscles sit at the bottom of the bowl of the pelvis. And so as you sit on something soft like a ball, or you could also sit on a chair or a couch, as you breathe gently into your back, and you can move your hips to help this too, you should feel your pelvic floor softening and moving. So with an inhale, you may feel something going down into the surface you're sitting on, and with an exhale, something coming away. But the important piece here is just to allow some easy movement, allow your jaw to be soft, allow your belly to be soft. Try to just feel like things are opening in your pelvis. The next exercise I'm going to show you is knee rocks. So for the first variation, you're going to put your heels and your knees together, and you can keep your hands on the floor if it feels good. And you're just going to gently rock your knees side to side. You don't have to squeeze your legs together hard. And where I expect you to feel this is in the lower part of your abdomen, close to where you had things tucked into the inguinal canal. You can also do this with your feet and knees spread apart, where you get a little bit more motion into that area, just gently rocking one side to the other. Same as with that breath exercise, keeping your jaw soft, your belly soft, just really gentle movement to get blood flow into that area. The next exercise we're going to do is rocking back and forward. For this one, you can move your knees wider than your hips and wider than your feet, hands in front of you, slightly in front of your shoulders. We're going to start by rocking your bottom back to your heels, and you should feel an opening in your hips as well as your pelvic floor in between the two sit bones. And then as we come forward, you should feel a stretch in your inner thighs and possibly in your abdomen. And we just rock gently back and forth between those two positions. Again, soft jaw, soft belly, easy movement, restoring blood flow. The last exercise I'm going to show you is a child's pose meant to allow your belly and your pelvic floor to fully rest and for your nervous system to come back to a nice baseline as well. So for this one, similar position, knees a little bit wider than your hips. You're just going to rock back and let yourself rest in this position. If you'd like to, you can put a pillow underneath your chest or your abdomen to really rest into it. You might feel this as a pleasant stretch in your low back, feel a softening of your pelvic floor, and a softening of your abdomen. As you're in this position, feel yourself breathing into your back instead of into your chest. So easy breathing and resting into this position for 1 to 2 minutes. One last thing to try, if you find that you may have tucked your erectile tissue a little bit too tightly, is to actually do some gentle stretching to that area. I recommend doing this in the shower after you've already had a chance to let that hot water warm up your tissue and keep it warm during this process. You shouldn't do this for more than a few times each way, certainly not any kind of aggressive stretching here. If we consider that when you're tucked, things are really compressed in this position, what we're trying to do is be able to gently stretch back this way, but you can also gently stretch to one side, gently stretch to the other. You can also do a little bit of very gentle traction. None of this should be painful. It should all feel very gentle and like a very easy stretch. If you notice changes to your urine stream, definitely consult your provider. but you can also do some of this stretching to help with that. For the exercises that I showed you in this video, you can really just spend about 5 to 10 minutes total after you're done tucking for the day. So for the breath work and the child's pose, do that for a couple of minutes. For the other exercises, 5 to 10 reps each way is probably sufficient. And same thing with the erectile tissue stretching. If you choose to do that, just a few minutes is really fine. I hope you found this video helpful. If you have any further questions or feel like you need further assistance, please reach out. I would be happy to answer any of your questions.